Hi, everybody. Thank you, first of all, for coming and supporting this evening. It means a lot to everybody here and a lot more people. My name's Alistair Green. I'm a C4 incomplete quadriplegic. So that means all 4 of my limbs have been affected. I had a car accident and broke my neck when I was 21. So I've managed for the first, 20 years everything was fine because, younger and fit. So when we've discovered the cryoneurolysis, it was mostly for my legs because I have a lot of hip issues. So I was having subluxation, which causes your leg to pull up and lock in place. Once I had the cryoneurolysis, it was, my analogy, it's like the Tin Man got out of the rain, right? So I finally got oiled and got everything moving, got lubricated in a sense, and just found, my range of motion improved again. I had a lot more ability. My pain was maybe 1/10 of what it was.
And your leg straightens out better.
Yep.
This one goes almost straight. Perfect.
After that, I've been able to move, like my right leg's way more flexible than it was. My left leg is back to normal. It was my stronger leg anyway. It just loosened everything up. It changed my life again, right? It got me looking towards the future and actually looking, planning on doing things again instead of being stuck, I guess. You feel like there's no way out. It's a life sentence. My pain's been amazing. My flexibility's been better. We did my shoulders.
I think we said we unparalyzed your shoulders.
Yes, we totally unparalyzed my shoulders. Without cryo, I don't know what I'd do. I was at a point of just hopelessness. It was amazing. I think it was a miracle. I've told all my friends, everyone I know in a wheelchair about it, and so it's definitely been a life changer for the most amazing.
You told me all the new things you did with transferring and using your hands. Can you explain those things that you told me?
So with the Botox, it was mixing up the signals from my nervous system until the body parts that worked. Not being able to transfer, dress, brush my teeth. But once with the cryo, it was full safety, being able to stand up again, being able to use my legs, being able to use my hands, raising my arms over my head to get dressed again.
What's different?
Freedom of movement in all my fingers. There's not the pain. Doesn't seem the same tightness that causes pain. I'm actually moving my thumb more.
And with the cryo, it just gave me so much functionality and freedom, and also just independence, as my wife will say. She'll remember more than I do because you just end up taking it for granted. Obviously, as things get better, we just get used to them being better and we forget how bad they were. It's been, like I said, a life changer. It's given me a whole new lease on life again, so I can't say enough.
So one thing is that because he has spinal-mediated pain, cryo is like cutting a cord. So when we cut the cord in people who have regular spasticity from, say, a stroke, a lot of them can outrun their spasms by working with therapy aggressively. But when you have a spinal cord injury, the moment you plug you back in, the tone comes back. So for Alistair, he might call me at 9 months and saying my legs are kicking again. So we just treat them again. And many people will get a treatment after a year or two, and we get the same effect. So I'm always like, don't worry, because if it wears off, we'll just treat you again. Thank you so much for talking.